I'm Nick Smedira. I'm a cardiac surgeon working at the Cleveland Clinic. I've been at the Cleveland Clinic for 22 years now. I am both the feature editor and the CME editor, and I've been in that position now starting my second year. Advice to a aspiring author and contributor to the Annals or any journal of cardiothoracic surgery is to identify an issue you want to write about, really focus on this subject, and then set your objectives. What do you want to accomplish? What do you want the reader to take away when they're done reading it? Often your ability to comprehend is limited to like 1 or 2 points. So the manuscript should have a distinct purpose, then there's the results, and then focus the reader's attention on what you want them to take away, either in terms of future research, application to their clinical practice, and I think that's, as I do it, the best way to organize one's thinking. When I select a CME article for the journal, I have the opportunity to review often 4 to 5 manuscripts that have been accepted. And I read through each one thinking that a busy practicing cardiothoracic surgeon wants to read something that's applicable to their practice essentially tomorrow. So what is, of these 3 or 4 or 5 really excellent articles, what could somebody say, well, I want to read that because I want to know what it is? And I often prioritize it based on what I am struggling with on my day-to-day practice. A recent one is on how to manage the tricuspid valve in terms of tricuspid valve replacement. It's not something we commonly do, but when you are faced with it, you're asking, well, should I use a mechanical valve? Should I use a prosthetic valve or a biologic valve? How much anticoagulation? And so I choose and then structure the objectives and how it would impact your performance based on how I want to improve my practice. And I gear the question similarly with the idea that, as I said earlier, if you can take away 2 or 3 or 4 points from this that you can apply tomorrow, what are these things? And that's how I base the questions. The trends focusing on cardiothoracic surgery, we're drifting more and more towards a less invasive approach to the management of structural heart disease, both in terms of the aortic and mitral valves, and then some really fantastic innovative work in management of the proximal aorta. We focused initially on the descending thoracic aorta, then went to some branch vessels in the abdominal aorta, and now a lot of technology and mixing of open and percutaneous approaches are tackling the branch vessels and soon the proximal ascending aorta. Some very, very interesting stuff going forward. The most rewarding aspect of taking care of patients, I enjoyed a couple aspects of it. One of it is when I first meet a patient, invariably they're extremely frightened, they're anxious, and they're nervous. So the first interaction is just relieving their anxiety, building the relationship and the comfort between patient and physician, patient and surgeon. So that's very rewarding when you walk out and somebody says, I felt so much better after I met you. I'm really comfortable having this operation. That's very rewarding. And then the second is when you have somebody come back and who says, I couldn't walk up a flight of stairs without being breathless, and now I'm exercising with my teenage son or my grandson, and I can't be stopped. I'm doing everything and anything. You say, God, that's really rewarding. You know, I changed this person's life for the better in ways I can't even imagine. I'd like to maybe even this week shoot a round of golf in the low 70s. And then maybe easier to get to Mars than do that. But so no, God, there's so many things on my bucket list. I'd like to be able to read more. I like to travel around the world, but often have that opportunity in my profession. I like to be a better golfer.